Title of my presentation is The Miracle. So I'm presenting a 40-year-old lady who had presented with history of consumption of Paranax, paraquat dichloride, which is a for 24% concentration, 50 ml at her residence around 7th of August, Monday at 8:30 a.m. She was immediately taken to the hospital and a gastric lavage was done in the hospital and further referred to CMC for management on 9th of August. So on the way to the hospital, she had developed 3 episodes of vomiting, which was non-bilious, non-projectile or non-blood stain. There was history of 1 episode of loose stools, and there was history of excessive salivation and some throat pain. However, there was no history of any breathing difficulty. Past history-wise, she had history of systemic hypertension, but she was not on any regular medications. There was no history of any similar attempts in the past. Examination-wise, at the time of examination, she was conscious, oriented to time, place and person, not in distress. Vital signs were her blood pressure was 130/70 millimeters of mercury. Pulse rate was 88 per minute regular, respiratory was 16 per minute, and she was saturating at 98% on room air. There was no pallor, ictus, cyanosis, clubbing, or lymphadenopathy. Oral cavity on day of admission, the first day, there was congestion over the soft palate as well as the posterior pharyngeal wall. And however, the tongue was normal. There were mucosal erosions in the rest of the oral cavity. Systemic examination was unremarkable. So she was a case of deliberate self-harm with paraquat poisoning. So the investigations at presentation has hemoglobin was 11.8 with counts of 20,000 and platelets of 4.18 lakhs. And her initial on the day of presentation, her sodium was 136 with potassium of 2.8. Bicarb of 22. Creat at presentation was 1.87 with urea of 60. Over the course of the stay, her creat has actually improved, and at discharge, her creat was 0.61. Again, at presentation, her liver enzymes were within normal limits, bilirubin of 0.6 with SGOT-PT of 28 and 6. But over the course of hospital stay, she developed a acute liver injury. Her total bilirubin as well as direct bilirubin had gone up, as well as there was transaminitis, which by the time of discharge was in the decreasing trend. And her NPL scopy had shown bilateral vocal cords which are mobile. There was congestion of supraglottis. However, there was no history of any. There was no evidence of any airway edema. So we had done a CT, thorax, abdomen, and pelvis mainly. So, however, that did not show any fibrosis of the lung. So our diagnosis was a deliberate self-harm, paraquat poisoning with acute kidney injury and acute liver injury, which was in the resolving trend at discharge. So I know it's already been done. So paraquat poisoning, about swallowing more than 30 ml, a mouthful or two of 20 to 24% paraquat concentrate is usually lethal. So it was first invented in 1982 by two Austrian chemists, Dr. Hugh and his student M. Russo. But the potential of it as a agrochemical was discovered only in 1955 by a famous British company, which is called Empirical Chemical Industries. And it was used for the commercial purposes by 1961. So at that point of time, it was a very great breakthrough because of the speed by which it eliminates the weeds and other undesirable plants. And it became very soon it became popular worldwide because it was cheap as well as effective pesticide. And because of the toxic effect, presently it is banned in around 60 countries. So pathophysiology, mainly it affects the liver and the it mainly affects the kidney and the lungs. In the lungs, like we have already discussed, it has a structural similarity to the polyamines, and these polyamines are taken by the alveoli, type 1 and type 2. Polyamines are basically involved in the maintaining the structural integrity, differentiation, as well as the apoptosis of the cell. So since these have a structural similarity to polyamines, once it's uptaken, there is redox cycling, which releases toxic reactive oxygen species. Because of the toxic oxidative stress, there is damage to the alveoli, causing alveolitis as well as fibrosis. In the kidneys, the same thing, the reactive oxygen species accumulates in the proximal tubular epithelial cells, causing vacuolation in the cells, thus leading to a RTA. Same way, it causes mitochondrial damage. The reactive oxygen species causes mitochondrial damage, causing an endoplasmic reticulum degranulation, causing a hepatocellular injury. Mainly the effects in the lungs, it concentrates 10 to 20 times more in the lungs. So we could say pulmonary fibrosis is a hallmark for paracute poisoning, and acute respiratory distress symptom usually presents by 24 to 48 hours after exposure. This is a lung X-ray of a patient on day 7 with pulmonary infiltrates. In gastrointestinal system, about 20% of the ingested poison is absorbed by the stomach, and there are these lesions called paracute tongue, which is mucosal erosions in the tongue, like seen in this picture. It can also have mucosal ulceration. These ulceration can finally lead to perforation, mediastinitis, or pneumomediastinum. In the skin, it can cause skin irritation, blistering, full thickness burns, etc. We already saw this table. So about mild to moderate, I'm not going into it. So management wise, there is no specific antidote. There is only symptomatic management that is available. So usually oxygen, unless there is an hypoxia, we don't administer oxygen as a routine thing, because oxygen can increase can exacerbate oxygen mediated cellular damage, because the damage is caused by a reactive oxygen species. Now, if there are fluid overload, we prefer giving isotonic crystalloids. And main thing is to watch for signs of systemic illness, severe systemic illness, like hypoxia, hypertension, and acidosis, all of which indicate a poor prognosis. Gastrointestinal decontamination in the first few hours are indicated with activated charcoal or a Fuller's earth. Anti-inflammatory and antioxidants is already been spoken about. High-dose glucocorticoids and N-acetylcysteine can be given. The glucocorticoids either can be given as dexamethasone or a methylprednisolone. And if the patient develop any of the systemic symptoms, it is always better to provide a palliative care rather than a intensive care. So learning point so in our patient, she had developed over the course of hospital stay, she had developed dysphagia and odonophagia on day 3 of admission. So we had informed, we have included surgery also. However, her symptoms by itself actually improved over the course, and she was at discharge, she was able to take fluids as well as soft diet. So she is on close follow-up, and we have planned for scopies after 6 weeks to see the throat. So learning point, it is a corrosive poison with high mortality. Management is mostly conservative, and in case of systemic effects, palliative treatment is key.
See, did you give any medicines to this patient?
Medicines as
did you give any NAC, or did you give any?
Yeah, NAC was given. NAC and glucocorticoids. Dexamethasone and NAC was given to the patient.
Dexamethasone was given for how many days?
3 days.
3 days.
The importance is not towards some questions. Actually, paraquat is like acid. And the protocol which you have to follow to the system, same thing with acid poison. So if we are not, you should actually stop feeding it. Like if you don't, you have to do scoping 24 hours. It's not, I mean, it has to be deferred. The feeding should be deferred. So which is what we wanted to highlight in that case also. So that is one important thing. So not to do the stomach flush. And fuller flush should be given in 30 minutes, within 30 minutes, because soil inactivates parapet. So when the parapet falls on the soil,
Soil
it
gets
gets
inactivated.
Which is actually done in this form. So, but once it's happened, what we wanted to highlight with our patient is that you should not go to palliative care. Important is to try everything and treat. Though they may have like uh, poor prognostic factors. So you should try everything because they are all young. And third thing I wanted to point out is actually planned in Tamil Nadu. That is all the patients come from the other state, which is the Madhya Pradesh.
That's it.